Good evening, students. Today we are going to start an introduction to orthopedics. Orthopedics is a very vast topic, a vast subject. It is a vast studies which deals not only with the diseases of musculoskeletal system, but also it tries to study and makes an attempt to bring the body, injured body or diseased body, to as normal as possible. So orthopedics in a literal meaning means ortho means straight and pedics means child. This term was first of all coined by a French surgeon. His name was Nicolas Andre. In 1741, he brought out this term orthopedics. So let's do justice to him and start with orthopedics. This is an introduction. We'll study the chapters in detail subsequently. You see, since time immemorial, whatever creatures goddess or nature has produced in this world, on this earth, people have been sustaining injuries to the body, whether the muscles or bones or joints or nerves and the vessels. And therefore, according to the times, they have been trying to treat and undo the abnormality. So the ancient civilizations like Indian civilization, the Greco-Roman civilization, the Egyptian civilization, there is mention of splinting the fractured bones with the bamboos which were padded also. So basically orthopedics means that it is focused around rectification and cure of diseases, injuries, trauma, which involves basically musculoskeletal system, and far more attention is being paid to the bones and joints. You know how many bones are there in our body? Any guess? There are 206 bones in our body. 206. And our skeleton is divided into two parts. One is the axial part, another is appendicular part. Appendicular part means which deals with the bones of the limbs, and axial part means skull bones, the spine, the pelvis, the ribs, etc. So before we proceed, we should know a little what is the necessity of bones. The bones gives us a proper frame, a shape to any human being, and for that matter into creature also, animals also. And it protects our vital organs. What are the vital organs inside? You see, our brain is protected within the skull. Cranial bones. Our heart is also protected. Similarly, our liver is also protected. Okay? Our kidneys are also somehow they are protected. So it gives a safe shelter to our vital organs in our body. Not only that, without skeleton we cannot stand, we cannot sit, we cannot move, so therefore we have got bones and joints. It gives movements, and this is possible when the muscles interact. So therefore the muscles are attached to bones with the origin and insertion. Muscles, as you know, act through the tendons. So the musculoskeletal system is intimately involved with locomotor system. And bones, as you know, is by and large it is a mineral, it is a collagenous tissue, and there is each bone is having about 60% of calcium in various forms. And the bones, if you say we have a cortical bone and we have a spongy part of the bone, there is a medullary cavity, and any bone except few, there is a periosteum, the outer covering. Then there is the endosteum also. Periosteum covers the bones. And if you see the long bone, it is the various parts. The ends of the bones are called epiphyses. And the shaft of the bone is called diaphysis. And the junction between epiphysis and diaphysis is called metaphysis. So I'll try to explain to you when I'm online with you people I'll try to show you the certain snaps which I have taken, and today I could not talk to you online just because of such problems. Anyway, so I decided to talk to you on YouTube. Kindly focus what I'm talking to you. The lecture might go for extended period. I'll try to finish it in shorter time. Now, what I mean to say is, when we are talking about musculoskeletal system, we have a musculoskeletal system proper. We have bones, which we deal in this introduction. We have joints, we have ligaments, and muscles, nerves, tendons, and vessels, which are likely to be injured in musculoskeletal trauma. So, coming to basically what are the types of problems we can face? What are the major problem the mankind is facing these days? You see, with the increased mechanization, increased movement, transportation, the greatest problem we are facing today is injury to human body by trauma, road traffic accidents. Just I may introduce you to the fact that almost 150,000, particularly mainly the youngsters, they are losing their lives in road traffic accidents. So orthopedics throws a light at how much money, how much lives are lost, how much time and energy is lost in managing road traffic accidents. Besides, forget about sports injuries, falls, accidents, warfare, missile injuries, and things like that, which are preventable. What I mean to say is that we should be cautious about. Human body is a very sensitive, fragile. It cannot be wasted by just sheer negligence and carelessness while we are driving on the roads. The traffic is very heavy. So one of the greatest problems which we are facing today in a modern world is musculoskeletal system injuries. That is trauma. There's an article written by me on trauma. That is, one is road traffic accidents in India by Brigadier SM Sharma, and pre-hospital trauma care. Kindly read it. It will be useful for you, and it will disseminate the knowledge to others also how to prevent trauma. So when a person sustains injury, he is prioritized. He has multiple injuries. He may be having muscular trauma. He may be having brain injury. The patient may be having injury to the chest. He may be having, intraperitoneal hematoma and things like that. The person may have a polytrauma. He has got a brain injury, he has got a chest injury, he has got a liver injury, he has got a liver injury, he has got a fracture of the long bones. So prioritization, which part to be tackled first? When a body is injured, you cannot straight away take a person, as you see in films or something like that. The person is straight away taken to operation theatre. No, the person may have hurt himself to the extent that he is bleeding. There is a massive hemorrhage. Multiple patients, he is in a state of shock. The pulse is not palpable. BP is not recordable. And patient is, struggling for breath. So first and foremost thing, which the basic purpose of this is, when you tackle any person, remember the word resuscitation. We are using certain technical terms also. Resuscitation. Resuscitation means we have to make the person, injured person, to withstand the operative procedure. You cannot operate on a person straight away, fix the fractures. Okay, so therefore person has to be resuscitation. Resuscitation means we have got a very well laid down principle of management of the trauma. I'll go step by step. I'm talking about trauma at the moment because it's very important. The first and foremost thing is there is the Advanced Life Support System, ATLS, Advanced Trauma Life Support System, that whenever you come across as a doctor, you'll be called upon. When you're putting on a white apron, nobody says which branch of the, human management you belong to, you are a doctor. You may be all alone, you may be posted to some remote place and nobody else is there, and traumatized patient is brought to you. So therefore, you must read. If you people read, you will commit less mistakes and you will not lose lives. Those people who do not read will commit mistakes and people will lose their lives. We have no imagination, we have no pre-hospital trauma care, we do not know how to lift the patients. We lift the patient who is injured on roadside like a sack, body. So our people has to, their awakening has to be there. And the awakening starts with the doctor, to students. Teaches students, the student disseminates, he practices it, how to save the patients, traumatized patients. So what I mean to say is, whenever there's a road traffic accident or any type of injury, you have to apply your mind to advanced trauma life support, ATLS, which means resuscitation, in primary survey and resuscitation simultaneously. You are resuscitating the patient, there is a team of doctors, somebody is giving IV fluids, somebody is maintaining the airway. So therefore it is divided into A, B, C, D, E. First of all, A. You have to see whether the person is breathing or not, airway. Then breathing, is he breathing or not? Airway is not obstructed, airway. Airway is patent, the person can speak, talk, that means airway is okay. Whether he is breathing or not. Then we pay our attention because the traumatized patient has lost quite a, there may be a massive hemorrhage. So therefore a circulation has to be given, right? D is a disability, different part of thing. Person has got head injuries, neurological status, and he is exposure according to temperature, is the heat or cold. Patient has to be protected from environment factors also. Anyway, these things will study later on. So what I mean to say is, basically I am telling you that in trauma, before you do anything, patient has to be safely evacuated to the hospital. And en route, you cannot do, when you're on the roadside, you start doing cardiac massage to the patient, you're wasting time. Take him to the hospital first. Unless the person on the site of accident is trained, he can do it. Once he's in the hospital, then of course, the experts take on. But basically, you have to allot priority, which injury to tackle first. Priority 1, 2, and 3. There are 20 patients might have come to you, 50 traumatized patients are there. So you have to allot a priority, which person can be saved. First, the person who's bleeding, who has got intraperitoneal hemorrhage, who has got a chest injury, he has to be tackled first, priority 1. Priority 2 is something like fracture femur, he can wait, and priority 3 is walking, wounded, conscious, oriented, and things like that. And then the trimodal distribution of death. Trimodal distribution of death. The first golden hour, that means a person has got, there's one injury with, say there is an injury to the heart, there is injury to the major vessels, so person will die on the spot, whatever one may do. If the aorta is injured, probably nothing much we may be able to do for that person. In trimodal distribution, one is the instantaneous death at the site of accident, road traffic accident, severe head injury, things like that. But then there are patients who are bleeding, medium-sized vessel is injured, there is injury to the liver and spleen. So first golden hour, if the person is brought to the hospital, you do resuscitation, give him IV fluids, give him blood transfusion, correct his airway, correct his breathing, do his endotracheal intubation. Endotracheal intubation means you go the artificial breathing with the help of insertion of endotracheal tube into the trachea, and then giving oxygen gases and things like that. And simultaneously you are resuscitating by giving IV fluids. So this is the first golden hour where the life, if you do not bring the first 1 hour to the hospital, the person will die. Then comes your 50% of the categories, they fall into this. Then comes your second mode, where the person has been brought and person is in the hospital, and he can be saved. And third mode, of course, is the person has been operated, but unfortunately due to infections and complications he loses life. Anyway, so What I mean to say is trauma is basically a great problem of the mankind in modern world. Then next, where the musculoskeletal system is involved is, you know, right from his childhood, congenital problems are there. A baby is born with congenital problems, and there are so many causes of this. It may happen during the childbirth itself, and one is, cerebral palsy a baby may get, or there may be, brachial plexus injury, and then person is born with deformities of bones. So there are certain kind of deformities, which are quite glaring and not so uncommon. And I'll use the term here in congenital deformities involving the bones. You should remember, one is valgus term, V-A-L-G-U-S, valgus. The another one is varus, V-A-R-U-S. Valgus means the limbs below the joints, they are deviated outwards. Like the knees, they are quite close to each other, but then the parts below the joint are deviated outwards. This is called, suppose it is concerning the knees. Knees are called genu, G-E-N-U, remember. We are using some technical words also, you have to understand that in orthopedics. Genu valgum, G-E-N-U-V-A-L-G-U-M, genu valgum. Now in genu valgus, G-E-N-U-V-A-L-G-U-S, the knees are touching each other, but the parts, the legs, they are deviated outwards. And genuous means that the parts below the joints, they are turned inwards. So this is called varus deformity. Okay, so the person may be born with certain kind of deformities. Then there are some diseases which are associated with bones and joints and musculoskeletal system. And the person may be having infections. When there is an infection of the bone, the term used for infection of bone is osteomyelitis. Osteo means bone, myelitis means the person who is having infection of the bone. Osteomyelitis, which may be acute, which may be chronic. Besides infections, what are the other? There are certain degenerative disorders. You see what happens with advancing age. Person may get degeneration of the disc, and elderly people have osteoporosis. The mineralization is insufficient. The bones are not that stronger. And with the age, person, his bones become osteoporotic. And I'll show you the x-rays in which the density of the bones, bone mineral density goes down, and these people are more prone to injuries, trauma, fractures. So fracture is a term which means the break in the continuity of the bone. Fracture, which may be because of what I said was due to trauma, or it may be because of some pathological reasons. Pathology. There may be some bony tumor, some diseases there, so therefore the bone gets fractured. Then there is some kind of fatigue fractures, stress fractures, forced marches, 12 hours, 13 hours a person marching, a person may have metatarsal fracture or something like that. So therefore, fractures is a break in the continuity of the bone. This is one of the important aspects of injury to musculoskeletal system. Then what are other things, other diseases which may affect the bones? Are the bone tumors. bone tumors. It may be benign tumor like cyst, or it may be malignant tumors like osteosarcoma, a deadly disease. We'll discuss these diseases subsequently, but I just want to remind you, when there is a malignant tumor of the bone, this is called osteosarcoma. There are so many types: Ewing's tumor, osteoclastoma, so many tumors are there. So one of the tumors which is deadly, is osteosarcoma. Then you see what happens is, when there may be a disc prolapse. There may be a disc prolapse, and it may compress the nerve roots. Person has got pain, which radiates, shoots down, sciatica pain. And when there is a degeneration, the new bone formation takes place, which are called osteophytes. The new bones, when there is, suppose, osteoarthritis. Osteoarthritis means arthritis of the joints, osteoarthritis of the knee joint. So the joint space comes down, and as a result of that, the person starts having pain, because the bones, I can say in layman's terms, they start rubbing. The stress, there is inequality. The stress body weight is not falling in a balanced manner, and the joint space is reduced. Okay. Then other diseases which may affect, there are certain terms which I would like to say. Dislocation of the joint. Dislocation of the joint. There is the contact of the two parts of the joint is lost. The joint is called dislocated. Like, say, for example, shoulder joint. There may be a dislocation. The head of the humerus comes out of the acetabulum, glenoid cavity. It may be a posterior dislocation, it may be a subcoracoid, coracoid, subcoracoid, subcoracoid dislocation. The other term is subluxation. I said dislocation of the joint means the contact with the two bones, joints involved in joint formation, they are losing the contact totally. This is called dislocation. Then there is subluxation. Subluxation is some part of the joint is in touch, but however it's not in its normal position. The third thing is fracture dislocation. That means you might have seen somewhere, if you see the X-ray, I'll show you those X-rays. Fracture dislocation. Fracture dislocation, that person has got a fracture also, say of the shoulder joint. He has got a fracture of the humerus. Out of the humerus, at the same time the shaft of the humerus near the shoulder joint, at the same time the head of the humerus is totally dislocated. Alright, so I have said dislocation, subluxation, fracture dislocation. I have told you there are congenital problems, that I have given you the example, valgus and varus deformity. There is a trauma, there is the bony tumors. And what happens when there is a trauma and a road traffic accident or something like that? The muscles may be injured, because the relationship of the muscles and bones, very well. They are originating from it, they are getting inserted in the other place, so for the movement. So before the bone is injured, definitely some kind of injury will be there to the muscles also. There's one term which we call as contusion. Okay, contusion. There's hemorrhage, there's injury to the muscle. There may be laceration. It may start bleeding. All right. And if the limb is involved, there's a crush injury. There's a road traffic accident, and thigh is compressed or something like that. There will be a bleeding inside. The muscle gets swollen up, and in such a situation, if this happens in a closed compartment, there's a compartments in our legs. So therefore, there's so many complications. Person may have myoglobinuria, muscles are damaged, and in the closed facial compartment there is a swelling because injury to the muscles, edema, collection of blood, and therefore as a result of this there will be a compartment syndrome. What it is called? Compartment syndrome. It is called compartment syndrome. That means in that particular compartment there is a swelling because of injury. There is edema, there is a blood loss, there is a hematoma, and muscles are contused or lacerated. And when this kind of situation arises, it's a very dangerous thing. And as a result of edema, the venous drainage, venous flow is affected because of the swelling. And there is a rise in pressure within the compartment. And subsequently, the arterial supply to the distal part of the limb is affected. Now this becomes compartment syndrome. A person may lose his leg, and not only that, person might lose his life as well. So immediate intervention is required. So specialized branch of orthopedics is tackling this issue. Anyway, proceeding further. Now one of the greatest investigations which has come to rescue the mankind is X-ray. X-ray will tell you take an X-ray of any part, the bones are the first thing to be visualized clear and straight. You can make out basically the trauma, the fractures. As I already told you, X-ray will tell you the dislocation. X-ray will tell you the subluxation. And X-ray will also tell you about, the state of the person is having degenerative disorders, osteophytes, joint space. And X-rays will also tell you about the configuration. You always compare, whenever you are taking an X-ray, you should take an X-ray above and below the joint preferably. Alright. And compare with the other side also if possible. Anyway, the second investigation which has come to our rescue is CT scan. I need not talk anything about CT scan. You all very well know the principal CT scan. That CT scan is a very good investigation. Third investigation, MRI. MRI is more often used in orthopedic practice. Okay. Thereafter comes the bone scan. Bone scan, if you do, you will come to know the person bone scan. Bone scan is done, with radioactive compound, which is injected, and then the person is scanned by gamma camera. So you will be able to find out whether there is any metastasis in the bone. Metastasis means whenever there is any malignancy in any part of the body, so it may get metastasized to other parts of the body, including bone. So bone scan will tell you about even infections. You can make out some infection of the bone is osteomyelitis. So this is another investigation. Then we have other investigations for the joints, like arthroscopy. You make a small hole in the joint and you can see the interior of the joint, what's wrong. Arthroscopy, or the arthrography also. And sometimes what happens is, due to injury, there may be collection of blood inside. There will be hemarthrosis. The term used, hemarthrosis. Hemarthrosis means there is the blood inside the joint cavity, within the synovial cavity. Okay. And it may be, pus inside, which is called pyoarthrosis. Person may be having septic arthritis. Septic arthritis term used because of the pus inside, because of infection, the joint is affected, or septic arthritis. Okay. Now, besides whatever I've told you, there may be injury to the nerves also. There may be injury to the nerves also. What are the types of nerve injuries? I think I'll cut it short and we'll carry on with the history and things like that subsequently. But I would like to stress on few terms in another, next time we'll continue with the introductory part. The nerve injury may be neuropraxia. Please remember neuropraxia. Neuropraxia, neuropraxia. Neuropraxia means the person has sustained injury to the nerve, but the nerves are not transected. So there is a temporary loss of sensation or something like that. Within 2 to 3 weeks, person recovers fully. That there's a blow or contusion, and therefore a person, will recover fully. Then another one is axonotmesis, in which axons are injured. That person will take little longer time. Then there is injury to the nerve, neurotmesis, in which it may be transected. The disability here is permanent. So either there may be contusion of the nerve or mild injury, neuropraxia, or there may be axonal injury, or there may be totally, the nerve may be transected. Nothing can be done about it much, and the disability is permanent. Then comes there are so many other factors, technical terms. As we start going ahead, we'll try to learn it. Then there may be injury to the vessels. Suppose there is supracondylar fracture of the humerus. Supracondylar fracture of the humerus. The brachial artery may be compressed. Once the brachial artery is compressed, the limb can get ischemia. Okay, distal part will become ischemic. Ischemia means when the particular part is not getting adequate oxygenation, blood supply, and the nutrition. So as a result of that, the person will start having pain, ischemia. And it can be best judged by passive stretch. If you ask the person, if you move his digit, the person will have pain. Ischemia, that is, there is a deficiency of oxygen. As a result, there is necrosis of the distal parts. Ultimately, if this fracture is not reduced, supracondylar fracture of the humerus, for that matter, any fracture with dislocation, which is compressing the vessel, post-trauma, will lose his limb if this compression is not reduced and the compression is not corrected. So therefore, in any orthopedic injury, one must see for the muscle power. So the person is able to move his limbs, digits. If he is able to move, that means see the color changes in the digits. That person is not having adequate circulation. Distally, there will be color changes after some time, and even gangrene may set in. So therefore, distal to the injury, you must palpate the pulse of the person. Incidentally, this is my right hand, not the left hand, because it is the other way around. Camera is in selfie mode. So you must see the pulsation of the person, radial pulse, brachial artery pulsation. So you must know where to see the pulse. Where radial styloid process sees the radial pulse, and brachial artery pulsation you see here, medial to the tendon of biceps brachii, not here or here laterally, medially. Now this reminds me, what is medial and what is lateral? Medial is towards center, inside, medial. Lateral means away from the medial side. Okay, you must be knowing about the planes of the body. There is a sagittal plane which divides the body into two equal halves, right and left. That's called sagittal plane. And if you move sideways, it is called parasagittal plane. Then coronal plane is which divides the body into anterior and posterior part. And the transverse, this is the transverse plane, this is the sagittal plane, and this is the coronal plane. Okay. So therefore, I was talking to you that whenever there is a bony injury, please see the pulsations distal to the injury. A person may be heading for ischemia, or maybe if not corrected in time, the person might have seen the cases where a person has been given, there is an injury, there was some bleeding, there was a fracture, and somebody is given a tourniquet, nice and good, and by the time he reaches the hospitals, and gangrene has set in. Gangrene is the death of the tissue with color changes, no pulsation, no sensations, no function. All right. Now, in this little talk, I would also like to tell you that you come across the terms in fractures just because as we move ahead, the fracture, it may be a total, alignment may be lost totally. Okay? The alignment of the fractured bones, the proximal and distal segment, is a complete loss of alignment. Displacement is total. The proximal two fragments of the fracture. We'll discuss later on what is comminuted fracture. Comminuted fracture means there are multiple fragments. Spiral fracture. Okay. Then the fractures are, one is simple fracture. Simple fracture means person has sustained injury. The bones are fractured, but there is no external injury. Compound fracture means the person has got fractured bones and there is a wound also, and the bone is visible. If there is even a small abrasion, bone is fractured but not visible, it is still called as a technically compound fracture. When a person has injured himself, the bone is visible, there is an injury, there is a soft tissue injury along with it. This is called compound fracture. Okay, and then fracture may be a spiral fracture. It may be a partly in touch. It is not a complete displacement, incomplete displacement, whatever you call it. And whenever any person who sustained bony injury, before he goes to the hospital, if he goes to the hospital, you do not apply any kind of a splint or a sport to fractured bones. He'll have pain during movement, during transportation. It's excruciating pain. So therefore, I'll request you that whenever you come across a person where you suspect the person is having spinal injury, do not lift him like a sack. Please, one person should support head and neck, the other one should support the back, the third one should support the hips and thighs, and the next one from the supports the legs. It's lifted like a log. It's lifted like a log in one piece, and not that otherwise. If he has got a fractured his spine and it becomes dislocation, the spinal cord will be transected and he'll have permanent disability. Below the injury, he'll have paralysis and the side effects of that. So therefore, whenever a person who has sustained a fracture of the limb in a road traffic accident or any accident, you provide him a splint, maybe even a cardboard or a piece of wood, or even an umbrella, or whatever, anything you can apply. You can apply a bamboo stick also, and just apply something, not very tight. If there is a bleeding, please arrest it by don't have that very strongly applied, not use too much of, force to tie a rope or something like that, or dressing. Give a compression dressing, the bleeding will stop. And a splint, the joint above and below. Okay, so that while he's transported to the hospital, he goes in a comfortable state. Now, I wanted to talk to you about whenever any person comes to you with orthopedic problems, whether it's swelling, whether it is an infection, whether it's a trauma, or any other problem, please take a history. Chief complaints, what are the basic complaints? Has he got pain or swelling or whatever? Chief complaints is called. This is followed by history of present illness. When did his complaints started? When did his complaints started? 1 month back, 2 days back, just now 1 hour back after injury. So the person comes to you with pain. So take the history of pain. How did it start? How did it progress? What is the type of pain? How does it increase? Okay? And then associated factors also you have to, depending upon the type of the disease. So it's called history of present illness. Thereafter you take history of past illness. What kind of medication he was on, what drugs he has been using, and all kind of information you should have about him in the past history. Was he hypertensive, diabetic, tuberculosis, some kind of diseases which are prominent, quite not so uncommon in present circumstances, with the hypertension, diabetes, tuberculosis, any CNS disorder, all right, or any kind of a disease which can be transmitted from human to human beings. And then briefly you can take family history also, social and personal history. What is his occupation means a lot in orthopedics. What is he doing? What profession he is in? Because the occupation of a person who is working for very long hours, he might develop over a period of time something to do with his musculoskeletal system, right? And a person is brought to you with a missile injury or a, you know, injuries which can, high velocity injuries or low velocity injuries. Somebody has fired something, firearms. So anything less than 300 meters per second, a person is brought to you with a bullet. A person has been struck by a missile with a velocity of 300 meters per second. It is called low velocity missile. It just injure the parts which traverses. And it will injure anything which comes in its path. But there are high velocity injuries, high velocity missile injuries. The bullet is passing at a velocity of 1000 meters per second. High velocity. It's called devastating injury. There is the effect once it passes high velocity, it causes a kind of expansion. Okay? There is a cavity formation and then it collapses, and something from outside will be driven inside. It will fracture the bones, and the bony fragment itself will act as a secondary satellites and cause further injury. The nerves may be damaged, the vessel may be damaged. So you must ask that particular type of injury. Okay. And with these words, I think I'll continue with the introductory part and the next lecture. And thank you very much, and kindly, if you have got time, kindly listen to what I've already said to you, because it's very, very difficult for most of the people to focus and concentrate for more than 1 hour, any case. And a person who can focus on his teacher is that person who comes prepared. If you have not come prepared, yes, it will make an impact. You heard the word, okay, what did you listen? Union, malunion, delayed union, union. Even though I'm talking, and it's just by the way I'm talking about. So these words would make an impact on your mind. But if you have come to the class prepared, if you have taken an interest, you are doing justice to your eyes, ears and life. Now coming to the class without preparation, and once you come to the class, you're not focusing, you're not paying any attention, that means waste. It's as good as not coming to the class at all. Once you have listened to talk of the teacher, you go out with some words. You remember some words, osteomyelitis, something like that. It makes an impact. Yes, you are going to talk to your seniors, your relatives, your friends, and they'll show you the X-ray. Doctor, you put on a white apron. Show us what is there. So therefore, you must come prepared. If you are not come prepared, listen intently, go back and read. Thank you very much. All the best.